Hi, and welcome to our webinar, Utilizing NextGen's Cost Estimation Tool to Meet the No Surprises Act. My name is Chelsea Grover, and I'm the Marketing Communications Manager for DAS Health. Before we get started on today's webinar, I want to take a moment to explain the process of the presentation for you. First, I'd like to mention this webinar will be recorded, and that we'll send out a copy of the slides along with the recording within the next week. Next, I want to remind you all of some super exciting news. As I'm sure you all know by now, Itentive is now part of DAS Health. DAS Health is a leading provider of health IT and management solutions and a trusted consultant to many physicians groups, hospitals, and healthcare provider systems across North America. By combining our skills and expertise, we'll be able to provide and support even more value and solutions for your practice. We're looking forward to continuing to serve you. And again, I want to reassure you that we are still here for you. We're still going to be here specializing in NextGen and keeping our focus on you. As you know, we specialize in healthcare. We're passionate about providing solutions for healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have NextGen add-on productivity solutions, including ChartGuard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. Next, I wanted to mention some upcoming webinars. Next week, we have 2 NextGen add-on product demos that might be of interest to you. On Tuesday, we'll be doing a live demo of that product I just mentioned, ChartGuard On Demand, which is a powerful tool that enables you to easily create PDFs of patient charts and clinical history instantly when somebody requests them. And on Thursday, we'll be presenting Multiple Encounter Billing Manager. It's built to automate the majority of the work required for entering multiple encounters and accounts on unapplied balances. So if you're interested in learning more about those, please feel free to drop us a note in the chat box and we can get you registered, or else keep your eyes out for an invitation that you'll be receiving later today and then later tomorrow. Okay, so finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Holland Lively is Client Solutions Analyst with DAS Health. They're both super eager to share their knowledge with you today, and so with that, I'm going to let them get started.
Great. Well, thank you, Chelsea, and thank you everyone for joining our webinar today on utilizing NextGen's cost estimation tool to meet the No Surprises Act. The No Surprises Act was passed into law and has various requirements that actually started as of January 1st this year. So what does this mean for your practice? Well, today we plan to introduce this new piece of legislation and explore the implications it may have on your practice. That's my section. Specifically, I plan to tackle the part of this rule that requires practices to provide good faith estimates for uninsured or self-pay individuals. As a result, Lexi and Holland are actually going to take it a step further today and focus on the new NextGen Pre-Services Cost Estimation tool that's available in the 6.2021.1 release and its functionality surrounding patient cost estimation. So they're actually going to review both the configuration and the workflow functionality. In addition, due to the nature of this complex act, we did actually include a brief section on suggestions for those of you who may not be ready to take that 6.2021.1 upgrade or who are not on that version yet, as well as answers some questions that we've seen pop up in our industry research too. We get it. We know finding harmony, right now especially, is very difficult when you're trying to balance all of these legislative requirements as well as your practice operations. So our goal today is to make sure you're aware of both the regulations and the tools that are available to you in whatever version of NextGen you're on. Now, in order to understand the functionality in NextGen, you need to know why it matters. And in order to know why it matters, we need to start with the basics. So first and foremost, what even is surprise billing? Well, what's called a balance bill may come as a surprise for many people sometimes. So a surprise bill is actually an unexpected bill from a healthcare provider or facility. This typically can happen when a person with health insurance unknowingly gets medical care from a provider, a facility, or they specify a provider of air ambulance services outside of their health plan's network. So surprise bills are expensive for the patient, the employer or the insurer, and the overall healthcare system. That is what we call a lose-lose-lose, ladies and gentlemen. We don't love that scenario. So this situation can happen when you can't control who's actually involved in your care. Think, when you have an emergency, or potentially when you schedule a visit at an in-network facility, but you're unexpectedly treated by an out-of-network provider. So if you think about it, in an emergency, right, an individual usually gets care at the nearest emergency department. Even if they go to an in-network hospital for emergency care, they still might get care from an out-of-network provider at that facility. Even for non-emergency care, an individual might choose an in-network facility or an in-network provider, but not know that a provider involved in their care, for example, maybe an anesthesiologist or a radiologist, is actually an out-of-network provider. So in some of these instances, a person can actually receive a surprise bill from that out-of-network provider that's higher than the amount they would have otherwise paid or had planned to pay with their in-network care. So the No Surprises Act protects these individuals from large, unexpected surprise bills. So official, right? The No Surprises Act establishes federal safeguards against surprise medical bills that have taken effect on January 1st, 2022. This rule was actually initially released by CMS on July 1st of last year. The goal of this legislation is to protect patients from those unknown costs of care, but also to ensure patients have access to the necessary information to understand the true cost of their healthcare services. Now, who's all protected by this legislation? Well, as of January 1st of this year, the No Surprises Act requirements apply to items and services provided to most individuals enrolled in private or commercial healthcare coverage. Think an employment-based group health plans, both self-insured and fully insured, individual or group health coverage on or outside the federal or state-based exchanges, federal employee health benefit health plans, and even student health insurance coverage. Some requirements, hint, hint, the ones we're focusing on today, also apply to providers and facilities with respect to uninsured or self-pay individuals. So one thing to point out is that requirements under the No Surprises Act actually do not apply to beneficiaries or enrollees in Medicare, Medicaid, Indian Health Services, Veterans Affairs Healthcare, or TRICARE. Now, the burning question, I'm surprised hasn't already been put in the chat yet, is who must comply with the No Surprises Act? And I'm just going to read the answer straight from the screen. The No Surprises Act requirements apply to all healthcare providers and healthcare facilities. The statute does not exempt any categories of providers or facilities from this requirement. I almost want to take a moment of silence here to really let that sink in. That is all providers with no exemption. So now that I'm sure I have your attention, let's look at what the NSA or the No Surprises Act does exactly. So this information is taken directly from CMS, and they state that 1, it prohibits providers and facilities from directly billing individuals for the difference between the amount they charge and the amount that individuals' plans or coverage will pay, plus the individual's cost sharing amounts in certain circumstances. It requires providers and facilities to provide good faith estimates of charges for care to uninsured or self-pay individuals upon scheduling care or on request, and for individuals with certain types of coverage to submit good faith estimates to that individual's plan or issuer. It creates a patient-provider dispute resolution process for those uninsured individuals to contest charges that are substantially in excess of the good faith estimate. It also requires certain providers and facilities to publicly disclose restrictions on valence billing. And it limits billed amounts in situations where a provider's network status actually changes mid-treatment or individuals act on inaccurate provider directory information. Now, notice the bullet point I bolded. This is the only thing we will be covering in this webinar today. The Act does so much more than just require good faith estimates for uninsured or self-pay patients. But this is all we're going to review today in depth. Now, spoiler alert, we will be hosting a regulatory-only webinar that goes over this entire piece of legislation in a few weeks. That will not be specific to NextGen, but I do want to give you an overview, just briefly here, of what each part of this rule contains. But again, just keep in mind, we're going to do a much more in-depth deep dive into all aspects of this legislation in a few weeks. So rule number 1 under the NSA established requirements related to balance billing. So on July 1st of last year, the first requirements related to surprise billing rule was issued to prevent surprise billing for patients in individual and job-based health plans who get either emergency or non-emergency care from out-of-network providers at an in-network facility or air ambulance services from out-of-network providers. Generally, this is going to impact providers or groups who perform services in a hospital or facility setting. Basically, this is going to regulate balance billing for certain services at in-network facilities. It's going to include things for emergency services and all services performed by ancillary providers as well. So Rule 2 of this act actually created new patient transparency protections. So a little bit later in 2021, on September 30th, the second requirements related to surprise billing rule was issued to provide additional support against surprise medical bills that could include these factors. One, creating an independent dispute resolution process to determine out-of-network payment between providers and facilities and health plans. Needing good faith estimates for medical services or items for uninsured self-paying patients. Setting up a patient-provider resolution process for disputes pertaining to those uninsured patients to determine payment due to a provider under certain circumstances, and also supplying a way to appeal certain decisions made by health plans. This rule broadly applies to providers in all settings. So again, this is what we're focusing on today. Overall, this Rule 2 created the requirement for providers and health plans to issue advanced explanation of benefits to insured patients prior to furnishing care. That portion has actually been delayed on the provider side until next year, but it does require providers right now to issue good faith estimates to uninsured or self-pay patients upon request or upon scheduling services. And then last but not least, Rule 3 was actually issued on November 17th of 2021. It is the prescription drug and healthcare spending rule. And it enforces requirements for group health plans to submit certain information about prescription drug and healthcare spending. So less of an impact here, but just informational so you know. This would include information on the drugs most frequently dispensed, information on the costliest drugs, enrollment and premium information, and even includes monthly averages of premiums paid by employees versus employers. So like I said, there are other portions in each part of these rules that will impact you, which is why we're doing a whole other webinar on it in a few weeks. But today we're just going to focus on that requirement to provide good faith estimates to those uninsured or self-pay patients, which started January 1st of this year. So what all of you on this call need to be doing starting like yesterday, literally, is providing a good faith estimate of the expected charges in advance of scheduled services or upon request to any uninsured or self-pay individuals. So what this means is that your practice must inquire within a specific time frame if an individual who schedules with your practice is enrolled in a group health plan, a group or individual health insurance covered maybe offered by their health insurance issuer, a federal healthcare program, or a federal employees health benefit plan. If they are, you have to then inquire if that individual plans to have their claims submitted to the plan. AKA, you have to ask if they're actually going to be using their insurance or paying themselves. If they're not insured or they're not planning to use their insurance, the practice then must provide notification in clear and understandable language of the good faith estimate of the expected charges, the expected service, and even the diagnostic codes of that scheduled service. So this GFE, or that good faith estimate, must be issued upon request or upon scheduling the service. If a patient requests the GFE and then later schedules care, a new estimate must be issued prior to actually furnishing that care. And that estimate has to include costs for the entire period of care, or the day or multiple days in which the primary service is being performed, and other additional services that will likely be furnished in conjunction with that primary service. So let me give you an example. A good faith estimate for a surgery. That may include the cost of the surgery, but it also needs to include any pre or post labs and tests. It also needs to include anesthesia, etc. What it's not going to include are items or services related to the surgery that may be scheduled separately. So let's say this was a knee replacement. This is not going to include the pre-surgery appointments. And for this example, it's not going to include the physical therapy afterwards. So you can see a graphic created by MGMA, the Medical Group Management Association, on your screen that tells you if a GFE or a good faith estimate needs to be created or not, reiterating kind of what I just explained in a nice organized fashion. So CMS has laid out very detailed requirements for these good faith estimates. So I'm just going to go ahead and read down the list of what they require. No other way to get around it. First or foremost, you need the patient name and date of birth. You need the description of the primary item or service being provided. You need the itemized list of items or services grouped by each provider or facility, reasonably expected to be provided. You need your applicable diagnosis codes, expected service codes, and expected charges associated with each listed item. You need the provider name, the NPI, and the tax ID of each provider included on that estimate. You need a list of items or services the convening provider anticipates will require separate scheduling and a separate estimate. You need a disclaimer on there that this estimate is in fact only an estimate of services reasonably expected to be furnished at the time this is being issued. You need to include information about the patient's right to enter into the patient-provider dispute resolution process. And you also need a statement indicating that the GFE is not a contract and does not require the uninsured patient to receive services from the provider listed on that estimate. Again, another MGMA graphic here, but it's a goodie. So this is going to show you the timeline expected by CMS for providing these good faith estimates. So you can see it starts with the patient scheduling a service. Next, the convening provider. It's a very technical term that they use in legislation, but it really means kind of that rendering provider or the main provider providing that care. Needs to reach out to any co-providers to get a good faith estimate for the services they may need to also provide. Think again, if this is a surgery, the surgeon would be the convening provider, but the anesthesiologist would be a co-provider. Next, you need to provide the full good faith estimate to the patients. So that means within 3 business days of scheduling that service, the patient receives a complete good faith estimate from your office. Now, the next logical question I assume most of you are wondering is, how is the No Surprises Act going to be enforced? What's going on here? And this is actually a little different than what we're used to. So typically we just get to say the OCR, the Office of Civil Rights, will come knocking at your door with a random audit or if someone tattles on you. With this act, states will actually have primary enforcement authority. So this is the case for both issuers of health insurance coverage in that state and also for facilities or providers offering services in that state. However, if your state does not provide adequate enforcement, don't worry, CMS will take that over. Also, don't get your hopes up too much. CMS is a creature of habit. So of course, they had to throw in a one-liner here that they may also conduct random or targeted investigations of providers or facilities. Now, whoever the enforcing authority is for your practice, they have to provide notice of a violation, including the information that prompted the investigation and the potential for a civil monetary penalty, or the imposition of a corrective action plan. So the violator, or if this was your practice and you were getting in trouble for this, you would typically have 14 days to respond, although CMS did state that period can be shortened to 24 hours or extended to 30 days or more, depending on the circumstances. They're really giving themselves a lot of leeway here. The civil monetary penalties for violations are up to $10,000 per violation. In determining what penalty to impose, CMS is going to consider a variety of factors. So they're going to include the degree of culpability, the history and frequency of any prior violations, the impact on affected individuals, the gravity of the violation, and whether any of these violations have been corrected by your practice. So the penalty will actually be waived if your provider or your practice does not knowingly violate, and here's the key, should not have reasonably known it violated this act. And then it also reimburses any incorrect payments plus interest. So I am sorry, but it is safe to say you all should know about this act. So there goes that loophole. Again, however, CMS is going to take all of this into consideration. CMS did pull a, don't say I never did anything for you moment here, with their announcement that from January 1st of this year through December 31st of this year, HHS will exercise its enforcement discretion in situations where a good faith estimate provided to an uninsured or self-pay individual does not include expected charges from other providers and facilities or co-providers that are involved in the individual's care. So this essentially means you need to provide the good faith estimate, but really focus only on the services you're providing at the practice. You don't need to reach out to those other providers like originally planned. This kind of leeway here is going away. This is going to be required again starting in 2023. So if you want to get ahead of the game, and start including that information, feel free. Now, to expand a little bit more on the state enforcement, just recently, CMS published a comprehensive list of state enforcement letters for the requirements under the NSA. These state letters outline CMS's current understanding of which surprise billing requirements each state is enforcing and what requirements CMS will enforce. The letters also outline whether the federal independent dispute resolution and patient provider dispute resolution process apply in each state and under what circumstances. Again, I know we didn't touch on those two topics in this webinar, but we will in our next one. So these state-specific letters will help providers determine what governing body oversees, your specific surprise billing requirements. So we provided the link for you to look up your individual state letter or letters if you have multiple, locations in different states. And sadly, I have not read all 50 plus letters. So any specific state questions, I'm going to have to refer you right back to this link as well. Okay. Well, that pretty much sums up the introduction. It was a bit longer, I apologize, than intended, but I think everyone needed some clarity on the why behind this functionality today and know what exactly is required. I'm going to go ahead and turn it over to Holland, who will take us through how to actually generate a good faith estimate using NextGen. So Holland, it is all yours.
Thank you, Lindsay. That was a great and very thorough intro to this NSA or No Surprises Act and what it could mean for the practices. So like Lindsay mentioned, I'm going to go ahead and walk us through what cost estimation and good faith estimates will look like using your NextGen. So first, really, what is the cost estimation tool? The tool allows your practice the ability to create what you may hear people referring to, or what Lindsay has referred to as good faith estimates. These good faith estimates are what is given to patient, prior to their services and allow you and your staff compliance with that No Surprises Act. So NextGen offers a solution with the cost estimation tool released as part of that 6.2021.1 upgrade that allows for pre-service cost estimation for completed and planned patient services. So for any of you on the line who have already taken your spring 2021 upgrade, you've probably noticed there's a new icon on the top toolbar of your PM application. I just want to point out the Estimate Patient Cost window can be launched from there or a multitude of other places, including from the appointment listing, the appointment book, encounters, people or patient lookup, the task menu, and you also can include it in your auto flow for check-in and check-out. That's a separate configuration that we'll go over today. But it really is truly going to depend on where you fall in your workflow as to how this tool is accessed. So as I just mentioned, this tool is included in your practice's decision to upgrade to the 6.2021.1 release. And cost estimation allows for a breakdown of that financial responsibility between both the patient and the insurance provider. I do want to point out a few additional features as well, one of which being the ability to add additional notes when utilizing that cost estimation tool. It's a free text notes box that allows you to make comments regarding the estimation. I do want to point out it's important to note that if those notes are made in the patient cost estimation tool, they will not print on any good faith estimate letter that would be further generated. There's also the ability in the tool to view all of the previous cost estimates that were submitted for the patient in the clinical history notes tab in the patient's EPM chart. And from there, you can also reprint that GFE if needed. So where does the cost estimation tool pull its information from to provide your patient with their good faith estimates? It uses information from contract allowable fields, encounter maintenance and practice copay amounts, encounter transaction histories, and NextGen eligibility verification. I do want to point out that you would need to be utilizing NextGen eligibility verification in order for this to be a point of information gathering, and a separate license is required for that add-on. So also included in the cost estimation tool is the functionality to launch the transaction screen to collect payments that might be due from that patient. And another eye-catching feature that many practices, including yours, may choose to implement is the ability to add cost estimation tool to your auto flow sequences. And again, we're going to go through that configuration here in a little bit. So I know a big question that many of you have is, how does the cost estimation tool ensure our practice with a solution that means we're in compliance with this huge piece of legislation? The answer is through the ability to create those good faith estimate letters. So in the workflow for the cost estimation tool, which Lexi is going to take a look at with us later, is the ability to generate or print a good faith estimate letter. With that being said, there is configuration required on the end of the practices in the enhanced form master file, where you will actually create, that custom GFE letter. In its current state, the letter is going to pull over the amounts for both the patient and insurance financial responsibilities, and your practice is going to manually add diagnoses and SIM codes, along with a few other easily configurable additions to meet the requirements of that good faith estimate. I do want to note that NextGen has indicated it is on the roadmap for the diagnoses and SIM codes to automatically be included in that GFE. So with that being said, once that GFE has been generated and the information has been pulled into the document and any manual information has been entered as well, the estimate will then get scanned back into the patient's chart and that GFE will have been created. So in general, the cost estimation tool is going to provide your practice with the ability to improve patient AR, increase patient satisfaction, allow for printing of that cost estimation letter through the enhanced forms. It also allows for direct transaction postings from the tool window. It adds for potential auto flow addition to support your check-in and both checkout workflows. And you can also configure your advanced audit log to include the ability to view some changes that have been captured with this tool. So as I alluded to earlier, we are going to go ahead and take a look at some of the customizations and configurations your practice will need to go through before implementing the cost estimation tool. So the first thing is to configure your practice preferences under that pre-services tab. So if payments are going to be collected prior to service using the cost estimation tool, that first preference will allow your practice to define the percentage that a patient would have to pay. The next preference under that, as you'll see when you get into that pre-services tab, would allow for updating the copay and deductible information for the patient's insurance listing based on what is returned from the cost estimation tool. The next piece of configuration is to define the transaction codes that will be used for collecting payments in the tool. There are new options for pre-service payment and pre-service bad debt that have been added to the transaction codes practice preferences that you'll see. Another feature to consider when utilizing the cost estimation tool and the ability to generate those good faith estimates is the customization of the estimation letter. So this is going to allow your practice to utilize, maybe approved letterhead and verbiage that's going to be reflective of your practice's specific information. And you can also decide if you would like to add a required signature from the patient when generating that cost estimation letter. So I do want to point out that a form does not come pre-installed, and this is going to be that initial step in configuration for your practice to generate the GFEs. So above, is a great example of what a GFE form may look like. So to actually, create that form, you're going to have to navigate into file maintenance and go into your, enhanced forms and create that new enhanced form, naming it something along the convention of your cost estimation form or GFE. From there, to select, the data fields that are going to pull over automatically, you'll expand your pre-service and estimate information to view those fields, and select and pull them over, where you want those to be included on your GFE letter. From here, you also can add the ability for an e-signature option to be required, and then you would go ahead and click Save. So that is the initial configuration that's going to have to be completed to generate any sort of considered GFE. There are some additional recommendations that we would like to make. So obviously, to meet the No Surprises Act of creating and distributing that GFE, additional fields and text are going to be required to be added outside of those automatically pullable pre-service estimate information data fields. So as we specified, if you're generating that estimate from an appointment, the location and provider information will be included in your enhanced form. And if you're generating it from elsewhere, those fields would be blank, and they will need to be manually filled in once the form has been generated. So additionally, you will want to make sure to include from the enhanced form data field the patient information such as name and date of birth, and certain appointment or encounter information, maybe location name, rendering physician. With that being said, you will need a blank field to include space for manually adding the SIM and diagnoses codes. And lastly, including verbiage from your practice that reiterates that the GFE is only an estimate of services reasonably expected, information about how patients' rights to enter into a patient-provider dispute resolution process, and also a statement indicating that a GFE does not mean that there is a contractual agreement between the patient and the facility to receive services. So adding the cost estimation tool to either your check-in or check-out auto flow may help you treat your patients with more efficiency while allowing patients to understand also, the financial services that are available. The placement of the patient cost estimation tool in the auto flow is completely up to your practice, and the configuration can be done to include it in either check-in or check-out. So to actually configure the auto flow to include the patient cost estimation tool, again, you're going to navigate into that file maintenance, and then in sister master files, you have your auto flow sequences. You'll open up the practice in which you want to add, and once you have that practice selected, go ahead and click your open folder button, and from the available list, click estimate patient cost, that item there, move it over into your included list, and go ahead and click OK. So now that we've kind of taken over, a certain amount of configuration that's maybe available or necessary with the tool, I'm going to go ahead and pass it over to Lexi, and she's going to go through, what you might see in terms of a typical workflow.
All right, thanks, Holland. So as Holland just mentioned, I'm going to kind of walk you through some of the functionality of this cost estimation tool and kind of what that workflow is going to look like for your users in your practice and kind of day-to-day. So as we've kind of already touched on, but just to kind of go in a little more in depth and reiterate, there are several places in the practice management application that you will be able to find this patient cost estimation window. So really, like as Holland mentioned already, where you're going to access this window is going to just kind of depend on the workflow, where the user's at the time, and what's going to be the quickest way. So our first option is to use the newly added patient cost estimation icon. So you will, once upgrading to the 6/2021.1 version, you'll see that in your top toolbar. This option will allow you to bring up the window and allow you to search for any number of patients without having to go into individual charts or appointments. We do also have the option to access the tool from our appointment lookup option. Just a note, if you do select multiple appointments when you're in that search window, you won't be able to open up the tool. So you can only open it up and search for one patient at a time. Another pretty common place is to access this window from the appointment book. So maybe you're looking forward at upcoming services or upcoming scheduled appointments, and you want to generate that patient cost estimation letter.
you can do that. And just as a note, that appointment, like I said, it can be in the future, which probably will be. So it does not need to be checked in or marked as kept in order to use that functionality. We'll also see that this tool is available when we're looking at encounters. So this would be, like for example, our encounter lookup. So we're able to, right-click when we're viewing an encounter and also access the tool. You can look up using our patient or people lookup windows to also be able to access this tool. So if you're not, there isn't an appointment scheduled, or you're not in the chart already, and you just want to look up the patient, you can do that. And I should say not just patient, the person record as well. Just a note, it's not a requirement to have a chart to be able to generate this estimate. We also will have the option to access this tool from our task menu. As was already kind of mentioned, this can be added to our autoflow sequences, so both that check-in and check-out sequences. So that is a separate configuration, as Helen just went over. So if you do choose to add that, just kind of make it part of the workflow, especially maybe at check-in, if there's a follow-up appointment, maybe you want to generate it then, that's an option. And then finally, we'll also see this tool available in the patient's chart on the clinical history and notes tab. So that's really going to give you the complete history of all the estimates that were previously created for that patient. And you can also access the tool if you want to, run a result at that time as well. So here you can just kind of see, if you haven't really seen this tool yet or don't have it in your system, to see our cost estimation tool, just kind of the layout. And we'll be going in depth with kind of all the different pieces and parts and how this kind of works for your practice. Okay, so when we actually need to go ahead and generate that estimate, and then alongside that, you can generate that letter that can be given to patients to satisfy, the No Surprises Act, as well as things like make payments. We would initiate that estimate patient cost window from the appropriate place in the workflow. So we just kind of mentioned all the different options. So you really, you would start that again, whether it's from an appointment, an encounter, kind of wherever is appropriate. Just as a note, if you are opening this window from the toolbar icon or a place like the task menu, you will be required to initially search for the patient. So obviously, unlike an appointment where there's already a linked patient, you need to tell NextGen which patient are you generating the estimate for. Then the next step would be to select either the insurance provider from the payer list that's available for that patient, or check off self-pay. Then you would go through, you would complete all of the required fields. So basically, short of, you need the patient's name, obviously, so know what patient this is for. We also need to select the rendering provider, as well as the location of the service. So those two pieces are required. And then finally, we do have an optional service type. So we can select from a list of basically the different service types. Some examples, like a diagnostic lab, infertility treatments, it's a surgical procedure, things like that. So there's a couple of different options just depending on what this estimate is for. Then finally, obviously an important part, if we're going to give an estimate, we need to tell the system what services are going to be rendered. So you would add all of the service item codes as applicable, and then any additional details as needed to kind of get the most specific estimate possible. So in this screenshot example, we're seeing the estimated cost section, or excuse me, the section where we would add in those details. And then that's going to generate in the estimated cost section, which will display the results based on what we enter here. So we'll start by entering all of the SIM codes that are applicable to this particular service. We can enter any modifiers as needed, again, just trying to get the most applicable or accurate estimation. There is a box to check off facility. So if the service where this is going to take place is a facility, as you probably are aware with billing, that's going to affect costs. So we want to check that off. The number of units in this field will default to 1, but you do have the ability to modify that as needed. So obviously if that's applicable to the specific charges you're entering, you can do that. And then we also have our estimate notes box. And this is just free text, allows you to just add any additional notes. Again, we've already kind of mentioned that what's in this box is not actually going to print on that good faith estimate letter. That's actually given to the patient. So typically they're a little more internal. So if you want to add any notes to be able to pull up later, you do have that ability. And then finally, you would click submit, and that's actually going to return your estimate details. So another functionality that's kind of convenient, while you're already here, you have the window open, is you do have the ability for patients to actually make payments, and you can enter them directly from this estimation window. So, again, if you are maybe running this while the patient is there, again, maybe they're at, checkout, and you're running it, and you can tell them, this is what your, patient estimate's going to be, and they want to make a payment at that time. You can actually collect it from the screen. So you'll see on kind of the right-hand side of this example, so we have the patient agrees to pay section, and you kind of have three different options. So the first is the minimum amount. So that would be essentially what your practice has determined is the minimum percentage of the total patient estimated amount that they can pay. So you can determine, just in internal practices what that should be. Then we'll have the full total patient estimate amount. So if they want to pay that, full estimated balance, they can do that. As well as we have another radio button for other amount. So they do have the ability, you can just free type in a different amount. If you do have some policies for maybe some kind of deposit that's different that you want to enter in there, you have that option. Then you go ahead and click that Make Payment button, and that is going to open up just our normal payment entry window. You would enter all the details, collect that payment, if it's by credit card or cash check, whatever it is, just like you would any other payment. So just to note, obviously, just like any other payment we ever collect in NextGen, it does require an active batch has been set by the user. But don't worry if the user who is running this or collecting a payment doesn't have an active batch set. When they click that Make Payment button, they'll be prompted to create a new batch or set one as active. So in addition to those payments, obviously, kind of the whole point of using this tool is to generate that good faith estimation letter that then we can give to patients and fulfill our requirements. So basically on that estimate patient cost window, we would have a button once we enter all the patient's information, the required codes, we can go ahead and then click print, and that is going to open up our print forms menu. So this is the same form, hopefully looks familiar if you're currently using any other enhanced forms. So you can use this to basically select the form that you created as a practice. If you have more than one version of the form, just as a note, the users will see them here in the list, and they can just choose the form that's appropriate for that situation, potentially if they're specific to the location or provider, anything like that. On this window, just like with any other form we'd print out of NextGen, you can specify a number of copies if you want to give them more than one. Change the default printer if needed, the orientation, everything like that. And then you'll have two options, either preview, so you can preview that estimate in the letter before printing, or just click print, and that will print out that cost estimation letter. As we also mentioned, if you ever need to go back and historically see, that good faith estimation letter, see, when that was generated, or maybe reprinted if the patient asks for another copy. So you'll be able to find the results for any of those previous cost estimations, as I mentioned, in that patient's chart. Just one thing to note about that, you do have the ability to, generate more than one estimate, or, regenerate an estimate, I should say. So if, maybe the services have changed, or the provider, location, whatever the case may be. So if there were multiple cost estimates for the same appointment or for the same encounter for a patient, the most recent or that latest estimate is what will be shown. So kind of the same concept you can think about, like generating a master document in NextGen. It's basically going to overwrite then what was previously generated, just so that way there's no confusion. The latest letter you see is really the final say in what can be given to patients, or if another provider or group needs to see that. So we'd access that in our patient chart on that clinical history and notes tab. There's a new section called estimation results. So you would see there, again, the list of all of those estimations that were previously performed. And then I can right click, I can print from this screen if I need to, again, like print out another copy. Or as I mentioned, you can select that estimate patient cost and really see all the historical details. So it would open up that same window. You can see all the detail and also rerun the estimate if needed. So if there's any changes. Okay, so now that we've kind of touched on some sample workflows, kind of how the tool works, in day-to-day life, I did just want to discuss, where exactly the different fields that we see on that patient cost estimation tool, on that window, kind of what they mean and where do they pull from in your system. So hopefully you have kind of a better understanding. So the first field that you really have to enter, short of after you enter the patient's information, is the payer selection. So the list of payers that you're seeing here on the screen really is going to depend on where you open that estimate patient cost window. So for example, if I open this window from an encounter, so like I use my encounter lookup, or it's from an appointment, so there's an encounter associated, like during autoflow, for example, it's only going to show me payers that are linked to that encounter. So see, the thought process is, those are the encounters that were deemed, to be used for this particular, visit or appointment or whatever it may be. So that is what you'll see in the list. Along those lines, just as a note, because of that, obviously, especially if it's an appointment or during the autoflow sequence, we do recommend that the encounter insurance selection window is placed before the estimate patient cost window in your autoflow sequence. So obviously, if you reverse those, then the insurance won't be associated with that encounter yet if it was newly created. If you open up that estimate patient cost window, so from anywhere else, like from the chart, that patient people look up an appointment, it's going to show the full list of any active or unhidden payers for the patient. So you'll see a kind of a broader list than if you're just looking from a specific encounter. And then we always have that self-pay checkbox as well. So that basically will be available, if the patient doesn't have insurance, obviously that would be the only option, or even if they do and they are choosing to pay out of pocket for a specific service, then you have that option as well. We also have, so in our provider field, as I mentioned earlier, that is mandatory. So that really is going to pull in to make sure that you're, pulling in the most accurate cost information. So again, this is another field that will depend on where your window is open from. So if you're opening this window from the appointment book or your appointment lookup, it's automatically going to pull in the provider that's linked to that appointment. Kind of on, similarly, if you're looking this window up from encounter lookup or the autoflow sequence, it's going to pull in the provider linked to that encounter. And then finally, if I am pulling it from like the people or person lookup window, my toolbar icon or task menu, that field will be blank. So you would just choose from the list. Same thing with our location. Again, this is another mandatory field. Also will depend, where you are opening this tool. So again, the appointment book or appointment lookup, it's going to pull in that location that's linked to that appointment. An encounter lookup or autoflow, it's going to pull in the location linked to that encounter. And then finally, again, any of those places that's not located or associated, with the specific appointment or encounter, that field will be blank as well, and you would just choose the location appropriate for that service. Then there is also a third service type field. This one is optional. And again, these just list these service types associated with the practice. So you can add, kind of choose from the list of what really describes the service that this estimate is being generated for. We have then our service items, obviously an important part of this estimation. This list, so when you start typing, it'll start, generating a list. That pulls from your practice default service item library. Any charges are going to pull from the charge amount that is listed in that default SIM library. And just as a note, it does also take into consideration any SIM exceptions. So again, hopefully we're getting the most accurate charge for this estimate. So we also have part of the patient cost estimation that can be a little trickier, a little less straightforward, is the allowed amount. So this allowed amount field, how it's calculated, is pulling from a couple of places. So it's looking at your contract library. So if you have any contracts set up in NextGen, in addition, it's looking at any contract exceptions, as well as any previous eligibility verification transactions. So if you do have, that RTE license, then it would be able to pull from that historically, with a note that that does have to be performed within the last 7 days. So it is just looking, if it's more recent information, obviously if it was a couple months ago or a year ago, then it's not going to be pulling that information. So here are some scenarios, kind of how that allowed amount, could be calculated. So if we do have a contract exception, a contract library, and historical transactions, it's going to pull from the contract exception to give that allowed amount. If we have a contract library and a historical transaction, it's going to pull the amount from the contract library. If we only have, so let's say you don't have contracts set up, for example, or not for this particular payer, or it's non-participating provider, and you only have historical transactions, that's the value it's going to use for that allowed amount field. And then finally, if you don't have any of that information, so no contracts, they don't apply, no exceptions, no historical transactions in 7 days, then that allowed amount field would be blank. So kind of along the same lines, we also have copay fields, deductible, coinsurance. So you might be wondering how that's calculated. So again, if you have that eligibility verification license, if you're using that real-time eligibility in your system, it is going to look in a couple of places to return those values. So again, kind of like with our allowed amount, it's going to look at existing eligibility transactions, again, as long as they're within 7 days, and basically return those values from that latest estimation. If the information is not found, but you do have that license in your system, it will perform an eligibility verification real time. So it will go and look and try to pull that information, again, if you use that product. If you do not have an eligibility verification license, so it's not something that your practice uses, then that copay and deductible information is going to be pulled from the insurance maintenance window if that information was added, and that coinsurance from any historical transactions if there are any available. And then finally, we obviously have the option for self-pay. So basically, if the patient doesn't have insurance or it's not covered, and the patient chooses to not use insurance, then you would check that self-pay box. And then that estimated patient cost is just going to pull in the charge amount from that service item library or look at those SIM exceptions, and it will just return the charge amount. So a little bit simpler, some less fields that are pulled in. Okay, so now we've looked at kind of a breakdown of the different fields that we have in our window. I'm going to turn it back over to Holland, and she's going to talk about some additional features and functionality.
Great, thank you, Lexi, for that insight into different workflows and field data sources that they might be seeing and wondering about with the tool. So we're going to take a look at one more additional feature and functionality that your practice may choose to utilize upon the successful implementation of the 6.2021.1 upgrade. And that is the ability to utilize the advanced audit log. So it's been updated to now include different auditable information regarding the patient cost estimation tool. So, to include that into your current advanced audit utility, going into that admin and then advanced audit setup from your PM application, is going to allow you to add to see when, maybe that cost estimation had been created, or if that adjusted amount, allowed amount, charged amount, things like that were pulled through on that cost estimation. So as we're kind of getting to the end, I know we're approaching the end of the hour here, but there might be some of you on the line who are wondering, I'm not quite ready to take the upgrade. This is coming with the upgrade. what exactly am I to do in a scenario where I need to be in compliance with the NSA, but again, I'm not quite taking that upgrade yet, and I'm not going to have access to this tool. So NextGen has recommended that clients on release prior to 6.2021.1 should utilize their enhanced forms engine and file maintenance. That's going to allow your practice to print a form containing basic demographic information, and basically is going to serve as a template for those patient cost estimation data information to be written by hand. So upon completion of that enhanced form, it will get scanned back into the chart, and that's really what's going to serve as that good faith estimate, or that GFE. I know it sounds manual, but it will at least ensure compliance with that No Surprises Act. So what are next steps? Obviously, like Chelsea mentioned in the beginning, we are here to help. So let us help, we can come in and assess current readiness, current workflows, provide recommendations, and even implement, new processes and new procedures for your practice. You can visit us at itentive.com or dashealth.com. We have, these informational webinars that we love to put on for you and your practices. And a little bit beyond that, we do offer 3-day fixed price on-site consultations, to go over clinical workflow, revenue cycle, front office workflows, or even, just general technology and performance standards. You can test drive our products or even consider, healthcare industry advisory offerings. So with that being said, I'm going to turn it back over to Chelsea. I'm sure we have questions on the line, so without further delay, and I don't want to take up any more time, Chelsea, it is all yours.
Great, thank you so much, Holland. And again, thank you everybody for joining us today. So we do have a number of questions. I'm just going to start rolling through them in the order that we received them. So first question, do we have to go through the pre-service practice preferences and transcode configuration prior to using the cost estimation tool? Holland, do you want to take that one?
Yep, I can jump in. So that's a great question. Typically speaking, the tool should work out of the box without going through those configuration pieces. But with that being said, we have heard from a few of our clients when going, through testing for their 6.2021.1 upgrade, that they were returned with an error when trying to run that tool for the first time. So we do recommend as a best practice just to go ahead and complete the configuration prior to utilizing the tool, just to avoid any potential errors.
Okay, thank you, Holland. Lindsay, looks like this is a great question for you. Can you define specialty? Can you define specialty? What providers have done to provide the GFE for services to uninsured or self-pay patients?
Yep, so I saw that. I saw that
specifically. My apologies.
No problem. So this is a great question. So unfortunately, defining specifically what providers this is going to apply to, I go back to that slide. This applies to every type of provider, specialty aside. Every provider across the nation will have to provide a good faith estimate for services to uninsured or self-pay patients. Regardless of setting, they have to do that upon request of that or upon scheduling care at least 3 days in advance. The uninsured or self-pay good faith estimate is a separate requirement from the balanced billing patient protections. So again, keep in mind we are going under, we're looking today at a very microscopic portion of this entire legislation. I saw another question come through the chat that I can address too, in relation to cosmetic voluntary surgeries and services as well. You are not exempt from this No Surprises Act. I would actually direct you to the American Society of Plastic Surgeons website. They have a great section on the No Surprises Act and how that will apply specifically to your services. But the same process needs to be followed here for those estimates for any self-pay or uninsured patients you see as well.
Great, thank you, Lindsay. Next question. Do we have to provide the GFE electronically? Can we provide it over the phone instead?
I can grab that one too. That's a great question. We've actually seen that one come up a lot. So the estimate can be provided in written form, meaning either paper or electronically. So for example, you can send that estimate through the patient portal or a secure email if you want to, if the patient requests that. You can mail it to them. Keep in mind it does need to be postmarked then within that 3 business day time frame. However, if your patient's requesting that estimate be provided, orally over the phone to you, or to them, excuse me, you can do this, but know that you still have to follow up with a written or electronic copy to meet the regulatory requirement. Keep in mind, you need to keep this document, in that patient chart and on file for at least 6 years for audit purposes. So yes, you can absolutely relay that information to the patient over the phone, but just know you're going to have to follow it up with some sort of either paper or electronic copy as well.
Okay, thanks, Lindsay. And I'm just going to throw in a warning here because I know that we are already over time. There's a few questions that we're going to skip because they're really specific to probably your specific practice. So if we don't answer your questions, please feel free to reach out to Lindsay or Holland. Their information's on the screen. Reach out to them directly. They're happy to answer your questions, but we just don't want to take up everybody else's times on some of these really specific questions. Okay, moving on. Is the cost estimator tool compatible with sliding fee scales? In other words, can the sliding fee scale be configured to the cost estimator tool at the back end?
Yeah, Chelsea, I can take this one. So yeah, that's a great question on something that's come up in the past. So currently, sliding fee integration isn't part of the tool that was initially released with the 6/2021.1 upgrade, but that is something on the roadmap. So they're kind of doing iterations of this tool, and that is something that's coming.
Great, thank you, Lexi. Lindsay, looks like we probably have another one for you. Hypothetically, if a private practice does not accept self-pay or they are out of network, or if they are out of network patients, are they exempt from this act?
Yes, I can grab that one. Well, whoever asked this, I like the way you think. Trying to find a loophole, I don't blame you. Just note, so I guess technically, if your practice is not going to see any self-pay or uninsured patients, then yes, this good faith estimate, I guess, would technically, it would still apply to you, but you wouldn't have any reason to do so. However, you can't say that the No Surprises Act just doesn't apply to you or you're exempt from this act because, like I said, we are looking at a very tiny piece of the pie at that specific requirement of the legislation as a whole. So there are absolutely pieces of this legislation that will apply to your practice, even if those are the only types of patients you see. I would just encourage you to sign up for our future webinar that goes over the entire legislation versus just the good faith estimate. So I hope that answers your question.
Great, thank you, Lindsay. Next question, for payment, is 0 an option?
Chelsea, I can take this one. So I'm assuming if you, in your example, you're saying like the patient doesn't want to make a payment at that time, when the estimate is generated. So I would say yes, technically 0 is an option because that field isn't required. So you would just essentially leave that blank if there is no payment that needs to be made. And then you can just go ahead and print that letter like you would for any other patient. So you wouldn't have to, that's a good point. It's not required to enter a payment.
Great, thank you, Lexi. Next question, do you have the ability to print out these in other languages?
Chelsea, I can take this one as well. So yes, essentially, you create these letters in the Forms Enhanced tool and file maintenance, as Holland mentioned. So you can essentially create them in as many languages as you would like. So you could, it's not going to default or like pull from the patient's, preferred language or anything like that. You would just have different options if you chose to do that. And then it would just be on whoever's, generating the letter, they would check off the appropriate, letter in the correct language in the list, if that makes sense. So you do technically have the ability when you create these, if you wanted to create multiple options in multiple languages, you could do that as well.
Thanks. Holland, looks like this might be a good one for you. If a patient has 2 insurances, for example, a primary and secondary, what do we do?
Yeah, I can take that. So in its current state, the tool right now is only able to generate cost estimates for one insurance at a time. NextGen has indicated that they're exploring the ability to create an estimate where multiple insurances have been selected, but as it stands right now, you have to do them, insurance by insurance.
Great, thank you. And looks like we have another one here. What happens to historical GFE letters if we modify our enhanced form and we want to reprint them from the clinical or historical notes?
Yeah, sure, I can jump on that one too. So any modifications that are made to that enhanced form are going to supersede, the original format in which that letter had been generated. So, if you go back into your clinical history and notes and you want to right-click reprint, that reprinted letter is going to follow the modified format. So it would be pulled into that new format.
Okay, thank you, Holland. Okay, so it looks like we still have about 15 more questions to answer. So we really do want to we want to answer them, but they're really pretty specific or specialty specific that we really encourage you to reach out to us directly. You see both Lindsay's and Holland's information up on the screen. You can reach out to them directly. You can also reply back to the email that I'll be sending with a link to the recording and the slides. If you know Lexi's information, you can reach out to her directly as well. Sorry, Lexi, I forgot to include you in these slides. That wasn't purposeful.
We all talk every day anyway, so.
But we really are eager to help, so please do reach out to us. We are not avoiding them or anything like that. It's just that we do have a number of them left to go, and we're already way over time. And sorry, this was jam-packed full of information. We usually do try to time them better so we can answer all the questions. But we appreciate you joining us today, and I'm sure that we're going to see many of you back at the surprise billing one that we're going to be doing shortly here on all the regulatory things that Lindsay mentioned earlier. So again, thank you all. Thanks for joining us and under our new name with DAS Health. We're excited for those changes, and have a great rest of your week. Thanks for joining us.
Yes, thank you, everyone.
Thanks, everyone.
Thank you.